We will turn the floor over now to our third student speaker of this session on justice, and that is Nadia Bay. Nadia is a second-year undergraduate who is studying global health, dabbling a little bit in journalism and in biology, and perhaps working towards a program too, but we'll find out soon. And she's going to be talking to us on communicating toward health justice.
Yeah, thank you so much, Tori. So of course, as she said, today I'll be discussing health justice. The COVID-19 pandemic has raised a lot of questions about how to reach people most effectively when it comes to things like vaccine distribution, care delivery, and things of that sort. And as someone interested in both public health and journalism, I think a lot about the dissemination of information and how we can do that more equitably. So my presentation will be exploring how communication can be used as a tool to achieve equity in health outcomes. And so first, I want to define this term health justice. Health justice is defined as the use of law and policy to eliminate unjust health disparities. And this definition was created by a law professor at Wake Forest, Emily Benford. I'm not a lawyer by any means, but I think policy is really important for developing the structures that allow people to achieve health care and learn more about their health and essentially maintain good health. And I also have this quote from a podcast I like called Shiny Epi People. And the epidemiologist Abdul El Sayed said, "How many more papers do we need that show us that poverty and segregation and racism are bad for people's health? Yet while we have the courage to be asking these questions, sometimes I worry that we lose the courage to advance a public policy that is true to what we know." And I included this quote essentially because as I think it conveys that it's not enough to just talk about healthcare, talk about equity without actually putting things in place that allows people to achieve more equitable care. We can't talk about things with no end goal. And that leads to my main point. Policies can't be made without people, and as a result, health communication remains important. So why communication specifically and not anything else? According to the Department of Health and Human Services, as health communication is important for a variety of reasons, but I've highlighted 3 of these in particular. Number 4 and number 5 deal with health campaigning, which is relevant to our current situation because how we give information affects the population's overall health and safety. But I've also highlighted number 7, the education of consumers about how to gain access to the public health and healthcare systems. This is particularly relevant because I feel like a lot of the other considerations on this list depend on access to providers, like professional patient relations, development of telehealth. So ultimately, I believe that communication should foster access and knowledge about healthcare, as well as contributing to that law and that policy that would help with healthcare in the long run. And access is important for one more reason that I'll get to in a second. But first, I want to propose this question of who do people trust the most? And I've divided this into 3 categories, sort of based on what we've seen during the pandemic. So first we have the internet and social media, journalism, and then we have healthcare providers and local, state, and federal government. So does anyone want to guess which group people might trust the most when it comes to health information?
I would assume it's the healthcare providers, but I feel like that might be the wrong answer.
That is actually the right answer. I'm not sure if people guessed in the chat because I can't see it, but yes, it is actually healthcare providers. In a 2013 national survey about health information, 94.2% of respondents said that they trusted their healthcare providers to give them information. And in a December 2020 survey by the Kaiser Family Foundation, that was 85%. So even though the percentage has dropped a little bit, healthcare providers still remain the most trusted source of information for patients. And this has remained relatively stable in comparison to other sources of information, such as mass media. However, or based on this information, it may seem like we just want to go through healthcare providers for information. But there's 2 things to be considered here. Some providers can still be gatekeepers. in one of my courses on health communication, we talked about how some providers are actually resistant to patients bringing in more information than they're expected to have. They're very resistant to patients Googling their symptoms because they want to be the sole arbiters of information in the exchange. They want to be the experts. And that's really just not helpful because they need to treat the patients themselves as the experts. So that damages trust in one way. Additionally, provider biases can impact what they disclose to their patients themselves and the kind of care that they deliver. The other consideration is that demographics impact which form of communication works best. For instance, older populations may be easier to reach through television or radio. I know immigrant populations rely a lot on WhatsApp, and essentially people have families in other countries. So there's different methods of communication to take into account when it comes to things like disseminating health information. So there's kind of two facets to health communication that I've came up with. So first, there's access, which deals with influence, like who has the authority, who's being heard, who's speaking. And then there's also presentation, which deals more so with language. And I've also have these other bubbles surrounding the main ideas. And rather than viewing them as separate things, it's easier to envision them as like an overlapping web. Like for instance, going back to my quote about research earlier on, when thinking about research papers, who has access to research papers? Is people in academia? Is it open source? Things like that. How are the papers written? How are they explained to the public if they're being explained at all? And then how does that tie into things like policy? I know that most people probably don't read the laws that come out of Congress or state government, places like that, but it's ultimately still important for them to understand what's in those policies. So how is that being communicated to the public? And there's also things like policing. Police have a lot of influence in media narratives, even though that should really be shifted more towards like the community. And people who are incarcerated don't have access to the same information to people who aren't. And then there's also things like advertising. And last year I worked on a research project that dealt with prescription drug ads. And I was focusing on how like the language and visuals in the ads impacted people's understanding of side effects. So these are all things that need to be taken into account. And then there's also community networks. If you don't have a network, obviously you don't have access to the same information. And then when you're within a network, there's specific language within that network that impacts how you learn things. So these are all things to just consider when it comes to communication. So based on all of the things I just said, what is the right solution? And the kind of obvious answer to that is that there's no one size fits all solution. Even when I was planning this presentation, I tried to come to a definitive conclusion and I really couldn't because ultimately there is none. People are different, communities are different. We need to have a different approach to each of these things. But the two main questions I want to consider based on the categories I just discussed are, does my intended audience have access to the information I want to give to them? And if they have access, can they understand it? So ultimately, do people understand how to sign up for a vaccine appointment? Do they understand what's in the vaccine and how it'll affect them? And ultimately, just giving them all the information they need in order to make informed decisions about their health. But although I don't know a final solution, the one thing I do know is that digital alone does not work. The internet is a very influential source in the world right now, obviously, but relying solely on the internet does not help. On the top left, I have some examples. Like in Orange County, some residents don't have the internet access. Broadband is an issue. Older adults struggle to access vaccine appointments. In the top left is an article from Charlotte Observer talking about the previous election, 2020, and how ultimately Republicans got the upper hand because they actually did more door-to-door, or not advertising, door-to-door connections, while Democrats relied on digital advertising, which ended up being an issue. And then on the right, we have examples of different approaches to information. The Marshall Project is a journalism organization that focuses on prisons, and they're experimenting with snail mail to mail articles to incarcerated people. So that's one way to reach a population that's not often included in public discourse. And then there's also Radio Indígena in California that essentially shares health information with the community. So there's like language barriers, access information, and yeah. And then this last slide is just my influences in developing this presentation. And thank you all for listening.